Hepatocellular carcinoma. My name is Ninosca Rosado. Introduction. Hepatocellular carcinoma is the most common type of primary liver cancer. It most commonly develops in people suffering from chronic liver disease, such as cirrhosis caused by hepatitis B or C.
Nuclei, whereas when you look at the cells of the hepatoma for comparison, they are large, they are irregular, as composed to the fairly uniform regular nuclei here. Another thing I want to point out quickly, and I hope I can, is that also in this field you see something instantly very red up here in the northwest. And usually when you see something very red, it's either extreme blood, extreme fibrosis, or extreme necrosis. So let's see what it is. Well, this part is certainly very red because of fibrous tissue. But I think that the real red stuff, to me, looks like an area in which you cannot differentiate cellular structures anymore. So this is the red of necrosis, isn't it? And all of these cells out here, pigmented, could very easily be macrophages that have either taken up blood pigment or perhaps bile pigment, because we're in the liver, aren't we? Thank you very much.
Diagnostic. Among the tests and interventions that allow the diagnosis of hepatocellular carcinoma, the following may be mentioned. 1. Blood test to measure liver function. 2. Diagnostic imaging tests such as computer tomography as magnetic resonance imaging with contrast, and advanced imaging products such as magnetic resonance elastography. 3. Liver biopsy, in some cases to remove a sample of liver tissues and analysis in the laboratory. Treatment. The best treatment for you will depend on the location and site of the hepatocellular carcinoma, the functionality of the liver, and your overall health. Hepatocellular carcinoma can be treated of the following ways. Destruction of cancer cells with application of cool-off-heat ablation process in which liver cancer cells are destroyed by applying extreme heat or cold is recommended for people who cannot under surgery. The surgery to remove the cancer and the margin of healthy tissues that surrounds it is maybe an option for people with early-stage liver cancer with a normal liver function. Liver transplant surgery to remove the entire liver and replace it with a resonance liver. It may be an option in people with other disease, in which liver cancer has not spread beyond that organ. Target drug therapy targets medications such as Nervarat can help stop the progression disease in the people who has advanced cancer. Conclusions. Hepatocellular carcinoma (HCC) is a primary malignant neoplasm of the liver and occurs predominantly in patients with underlying chronic liver disease and cirrhosis. It is believed that the origin cells are liver stem cells, although this is still under investigation. Tumors progress with a localized patient in their hepatic dissemination and distant metastasis. Thank you.